with this webinar. First of all, Dalvi, thank you very much for hosting this webinar, and thank you for the organization. Very nice. My name is Jeske. I am the International Marketing Manager at Vlow Medical for 6 years now. I was not involved in the development process. Luckily for me, Frank is, who is also joining us. So my proposal is to start off quickly with the presentation and start sharing our screen. Okay, let me see.
Okay, Jeske, thank you very much for this introduction. And Dalvi, thank you for having me in your Dalvi show, of course. Very nice words as an introduction, of course. We can go to the next slide, Jeske. Yeah, okay. It's not common for me to have a picture of me in the presentation, but for now in the Zoom meeting, I thought that maybe it's good to see who is talking to you. I'm an industrial engineer and co-founder of Nick & Holding and co-founder of Vlow Medical. I'm telling this because Vlow Medical is the company who has developed the 3-dose syringe, and that's for this webinar relevant, of course. And from my side, I think I'm a friend of Dalvi. I don't know whether it's the other way around, the same, but that's the reason why I'm telling you the story. And what I want to do is to give you some insights in how we developed the 3-dose. Next slide. First, a very small introduction of Vlow Medical. We are located in Eindhoven. On the right, you see a few pictures of our company. We are located in Eindhoven. That's in the south of Holland. And there we have a region where Philips has some old industrial buildings. And we are located in one of this building. And this building was a former power plant. And now it's called the Innovation Powerhouse. And Eindhoven is also, the region of Eindhoven is also very clever because there are a lot of big companies located, ASML, Philips, NXP. It's called the Brainport. Next slide. Then the timeline of Vlow Medical, and on the top you see when we started with Vlow Medical around 2013. What I was telling, or what I forgot to tell is, but that we are for over 25 years in developing medical devices. So on the bottom you see all kind of devices we develop for dentists or for medical purposes. So that's since 1997 we are in this business. But since 2013 we are developing syringes for injecting toxin. And in 2014 you see a picture, and then later on you see the current picture of the syringe. Next slide. So in 2012 we came up with some questions on the need for better toxin dosing, because we knew there was a more or less a standard syringe, and we notified that it was very difficult to have the small doses accurate dosed in patients. So that was a problem. And the other problem, the second bullet, is that it was also a problem for doctors to calculate, because they know they are not injecting milliliters, but they were injecting units. So they were constantly calculating up and down to have the right units or ml injected in the patient. Then, yeah, of course, small dosages is very hard to see on a 1 ml syringe. That was a problem. And what we recognize is that doctors need to multitask. They have to look at the syringe, what they are doing. They have to look at the patient, and they have to look at the exact case, where they are exactly injecting, and if it's the good way, position, yeah, the way you're injecting just the way you want. So this multitasking makes it a little difficult for doctors, of course. So we thought that could be easier. And the last bullet is about that. Yeah, there is always toxin left in the needle hub. So there is also a need for yeah, low dead space or zero dead space. So the product development was started in 2012, and then yeah, where we the product development is built up in different phases. You start with writing down the design requirements. What are we actually designing? Then we performed the market different analysis, looking to the market, what they really want, looking at competitors, of course. And then the actually design development phase is starting. We are thinking, coming up with ideas and concepts. And then if the final concept is there, then you can start prototyping. And with this prototype, you can actually inject and feel, look and feel whether it's actually working and doing what you did design previously. So that is testing, of course, of the prototypes. And if it's okay, then you can say, okay, let's go and start making tooling and start with the production afterwards. So the total development project was took about 2 years, from 2012 to 2014. And you see in the concept, we made a design which we managed to have 2 patents. And that's quite nice, because if you look at patents for syringes, you get 100,000 plus patents. So it's quite difficult to have some technology who is new and inventive, of course. All right. So then we made a set of design requirements. I have here a few bullets. The actual design requirements are, of course, longer sentences, and they are more smart, of course. We are not saying only accurate dosing, but also accurate dosing. We want to have it, let's say, accurate plus or minus X%. So it's very good to have a good design requirements at the start, so you can afterwards design and make yeah, concepts who comply to this design requirements, of course. Now, accurate dosing is, of course, an important one. Ease of use, more focused on the patient. Ease of use for, yeah, you don't have to calculate. The ergonomic could be better, and we want to inject very small injections, starting from 0.01. And we want to have this tactile audible feedback. 3 different scales, so that you can dilute and have different mixtures to inject and load that space. On the right side of this slide, you see yeah, use cycle. We start with this, just analyzing what has to do with all the activities a doctor is doing. He needs to install and prepare and dispose the syringe, and fill the syringe, inject the units, and maybe you need to place a new needle. What we focus on is, of course, in the injection. There we have made the 3-dose syringe, and the hiccups we have there, we managed to make it much more convenient and ease of use. Okay. So in the product development, I put some pictures here to see what we all did. For instance, on the left top corner, yeah, we analyzed the complete treatment, what you're actually doing. You're placing a pull-up needle, you suck up the dilution, and then you take a vial, you decap the vial if necessary, etc. Now, so we did this for different, not only treatments, but also Dr. A and Dr. B are working on a different way. So we what we did is make this all transparent, and that we have a complete analysis of how doctors working at this moment, or in 2012, of course. Of course, we did an ergonomic study. How do you want to operate the syringe? a few pictures there or sketches. And then we came up with a new design. Now, design is on the bottom, and the final product is the product you see right below. That was our first generation 1 3-dose with a plastic cap with a clicker inside. And at that point in 2014, we thought, okay, this is a very nice product. We managed to do everything, and this is what we really want and what the doctor wants. So then the next slide, please, Jeske. Yeah, here we see we were very pleased to have this nomination for the best product innovation in the Aesthetics Award. But some people have more luck than others. So Dalvi, he's collecting all these awards, and I think yeah, he's a real winner, of course. I made this screenshot from his website, and maybe these are not all of the awards, but it's really impressive, of course. Then the next slide, we had this product, and then we thought, okay, we need to come up with a customer survey. Are customers really satisfied? What do they think of the product? So we had a quite extensive survey, and we collected a lot of feedback. Now, the results, for instance, in this slide is that 67% was convenient. I said, okay, this product means that it's a better precision. We can inject, or I can inject more precise with this 3-dose product. 41% was thinking, okay, this is saving me bond toxin. Was also very good. And only 33% was thinking that the ease of injecting was okay. And that was concerning us a lot, because we where of course we wanted to have the best product in the market, of course. So our call to action was then, okay, we need to come up with a better product. So that's the reason why we started the development of generation 2. Now for generation 2, we here also a few drawings and pictures. On the left top side, you see we have this more ergonomic handle. And we have a better mechanism to have the real good tactile and audible feedback to the user. So that if you're injecting, you really feel the syringe clicking, but you also can really good hear the syringe clicking. So and we also think the thumb position must be bigger, so that you have a convenient, ergonomic, good feeling about what you're doing. On the right top side, you see that we managed to make a lot of prototypes with duct tape and wood and whatever screws. This is all to have a good feeling, feedback, and this is also in a concept phase to test all kind of different principles, whether they are good or bad, etc. On the left bottom side, you see two pictures. What we did is with some experts on the field of sound developing, looking whether we can optimize the audible feedback. And because we knew that the plastic generation 1 syringe had a very lousy clicker. You didn't hear very well. So therefore we had, in the new design, we had this metal part, which is really gives a good feedback. And that was our conclusion with the experts, that we improved the clicker very much. So and that resulted in the picture right on the bottom, that we had a final product 3-dose generation 2, and that's the current product we have in the market. So the product, the features are quite obvious, of course. We have this on the top. We have this display. You can see the remaining dose, so you can, if you want to, you can have a look how many doses are still in there. And on the bottom side, you have this handle, so you can have a free free movement of the plunger, or you can have this movement with the clicker. And from this plastic housing, you get this audible feedback. It's you hear it even better, and you have a tactile feedback because of the ergonomic handle. So what we also managed is do some testing. Maybe Dolby will talk about this later. That the dosing is really accurate, and a quite simple way of proving this is the picture on the right side bottom. There you see if you make this identical. Now I don't know the English word for druppels. Doses. If you make this identical dosing, you can visually see that they are really identical. And if you want to do this with a normal syringe, it's really difficult. And even if you have, even if you have this, if you can see it, it's difficult. But if you can see it, it's even more difficult, of course. So yeah, Dolphy will talk more about this later. So then we have the next slide. Yeah, this is a wrap up of the product. Yeah, we have a green and orange syringe with different doses for different dilutions, detectable audible feedback. Yeah, the display for remaining dose and ergonomic handle. On the right side, you see what we wanted to do is to have this a better clinical outcome. It's not for us to make a nice product. No, we want to have to improve the quality and a better quality clinical outcome. On the top, we have the quality improvements, so we can do more accurate injections. So every injection is exactly the same, and it's also reproducible. So that means if you have a patient today and with, let's say, 3 months later, that you can do exactly the same treatment because you know what you're dosing is exactly the same. And then you have also, of course, a predictable outcome. Yeah, and on the bottom side, you say, okay, more accurate drawing up of units, so you don't have to draw more than you want or whatever, so it's more accurate. There's no overdosing and no underdosing. I think that's also an important topic because, yeah, there are doctors who say, yeah, you can, the best thing to do is to overdose because if you dose too much, it's not bad, but yeah, I'm not a doctor, but I think if you overdose, then of course maybe initially you have the same effect, but the question is what will be the effect after a month or 2 months or 3 months. And the last bullet is also very important that the doctor has, of course, more focus on where to inject. He has only have to focus on the case and not on, yeah, the instrument he's using. Next slide. Yeah, this is the last slide. So what we were talking about is the 3-dose, who is used for all aesthetic applications, but the same product we have. It's actually exact the same product, but we are not talking about units, but about milliliters. That can also be used for medical applications. So yeah, that if there are drugs which need to be injected in very small volumes. Now, some 3 applications listed here are for radiotherapy. BioXmark, that is a brand who is marking cancer cells, and they can inject very precise markers so that for surgical purposes it's clear and the marks are visible on imaging. And then the precise bullet 2 is precise administering in ophthalmology, and the last is treating cancer in veterinary industries. So the product is really the same. We have also the green and the red dosing system, but we are calling it microdose. I think this was the presentation. Jeske.
Thank you, Frank. That's great. I can just ask you, the reason we call this talk from vaccines to aesthetics was I think the 3-dose is being used for the vaccination program now, isn't it? To try and make as much efficient use of the vaccines because of the low dead space.
Yeah, there's a low dead space in this syringe, of course, and the combination with the needle and the syringe. So yeah, that's correct.
Yeah. So, so if anyone's in the vaccination protocol, there we are. Try and persuade them to use the 3-dose. That's a plug. Fantastic. Thanks, Frank. Jessica.
You're welcome.
Thank you, Frank. Thank you, Delphi. What we also would like to share with you is we started commercializing the 3-dose brand last year by ourselves. And with this new, sorry, we invented, we created a new branding for the product. So in a couple of weeks, the logo and the website and the web shop will be updated with a new, fresh look and feel. And in order to celebrate our new web shop and attending on this webinar, we have created a special discount code for you all. I'm not sure how many doctors are attending this webinar who are already using the 3-dose syringes, but we are offering you all a 20% discount in our web shop for the whole month of March. If you just add the discount code webinar, you can order it for a less higher amount. Our web shop, who will be is still available at this moment. The new branding will be introduced by next month. We have created a much more user-friendly web shop, so you can with 2 clicks you can reorder the last orders that you have made. And the packaging will be updated with a fresh new look and feel, as you can see. So it's just a quick sneak peek of what's about to come with regards to the branding of 3-dose and how it looks. Okay, Delphi, I'm handing over to you then.
Thank you very much. Thank you. Has anyone got any burning questions they'd like to ask? You know, just quickly, you know, if you want to unmute yourself, I think we're a small enough group to take any questions now. Your last chance to talk to Frank, you know.
Yeah, I'm not that old, huh?
But I won't get hold of you again.
It'd be nice to. I wonder. Sorry, is somebody speaking?
No, carry on.
No, I would like to see it in action, actually.
Right, we will do that. I will
yeah.
show it to you. If you hang on, I will do a presentation and I will show you a live demonstration. Well, a live practical thing. Alison's asking, she uses a 0.3 ml insulin syringe. I mean, I tend to use a 33, I use an invisible needle, 32, 33 gauge needle with this syringe, and it works well. There is a practical aspect I will answer on that. While I'm answering the next question, I'm just going to do one little poll. Could you just answer this one of these 4? Just choose one question and answer it. There we are. One person saying they use the syringe. One person says don't 2, 3. That's good. 4. That's all right. I'd be very worried if anyone answers number 4. Okay, if you answer number 4, I'm going to get very concerned. Okay. And I'm sure someone's going to put number 4 just to upset me. I'm just going to delay a little bit longer. I can see Kate, our friend Kate Harding, is joining us shortly. So Kate comes in just when I'm about to do the presentation. Fantastic. Rajan's asking, do you order direct or is there a UK distributor? there are discussions going ahead, but you can get direct. I got mine direct last couple of weeks ago. Yeah, no, the syringe doesn't drip, so that's a good answer. So that's all right, good. So we've got some people using it, some people don't use it, but would like to know more. Fantastic. Jessica, if Tobias wants to know how to order from Germany, I suspect it's probably from the website.
Yes, yes. If you are going to www.flowmedical.com, we have a shop, and you can buy the syringes directly, and we will ship it the same working day or the next one.
Fabulous. Wonderful. Okay. Well, I'm just going to give you a little presentation about the 3-dose syringe and how I use it and how it works in my practice. So I hope you can all see and hear me. I just before I start, I'd like to just declare any conflicts of interest. You can see I have lots of different roles, but this particular talk is non-sponsored. So Frank and team have not paid me in any way, shape or form. This is because we're just working as a educational talk. So this is just a purely open talk, and it allows me to talk to you about other things as well. So Frank alluded
that's why we like you so much, Dolby.
Indeed, yeah. I have to work for my tea tonight. Frank alluded to this. When we're injecting, particularly with toxins, we're all really interested in accuracy. But we also have to think of quite a lot of other things. We're multitasking. And as a man, that's a difficult thing to do. Okay, multitasking does not come easily to men. You know, I can walk but I can't walk and talk at the same time. So one of those things is that we have to think of a lot of things when we're injecting toxins. We have to think about the anatomy where we're injecting. We have to make sure we're delivering the right amount in the right level. Is the patient in pain? Is the patient comfortable? All of these things, and anything that makes it easier and more accurate is, I think, always more welcome. So my history with the 3-dose syringe does go back to about 2014, when I was introduced to generation 1, and I very quickly took it up, and it was lovely to see generation 2 come on, because I think we had some discussions as to how you could move from generation 1 to 2, and this curved resting point for your handpiece came out of discussions that we had. But how does it help? Well, I think when you're delivering something, there are 2 things you need. You need a hardware, and the hardware is really your syringe, needle, and all those other accoutrements that go with your toxin delivery. And the software is us, you know, the practitioner. You know, if the software is faulty, like you have a shaky hand, or your thumb control isn't very good, you're not going to deliver accurate toxins, no matter how good the syringe. I mean, even with the 3-dose syringe, if you are too strong, you would inject too quickly and too much. So you need to have some software control, but you also need a good hardware. And I think we've got to a point where this is relatively good and is really difficult to move on. So let's look at, first of all, what do we have? What is available and what was available? And I've used all of these. Most of us have all used a normal syringe. And you all know one issue with that is the dead space. You know, there is a potential dead space. So people have come up with a way of reducing that dead space, and that sort of famous green Galderma syringe was actually quite a good one to use. I still have some, and I do use them when I'm using some of the Vlow products. But it is a very small syringe. The plunger is difficult to control, and you have to keep looking very carefully on the side of the syringe as to how much you're delivering. The other 2 syringes, the a diabetic syringe and the FMS syringe. Well, the diabetic syringe is designed with a slightly larger needle bore that's designed to go through thicker skin, and we have seen evidence that after injecting with that needle into the skin about four or five times, the edge of the end of the needle under electron microscope, it looks really blunt. You know, it is not really designed to go through the skin more than once or twice. The FMS syringe is also very good, but all of these syringes with a pre-mounted needle means you can't push the needle through the stopper, and you have to be very careful if the needle end strikes the bottom of the vial, because you can potentially blunt the needle. So the ability to change needles, to use a different needle to draw up your product, and then use a much finer needle. You know, I always joke when I bring this big 16 gauge needle to mix and draw up the product, I say to the patients, don't worry, you know, I'm not going to use this sort of needle, but it does scare a few people, but it's a good talking point. And then you put a very fine needle and the anxiety level goes. So there are some problems with the syringes already available. All syringes have an inherent error, because the machines that mark the gradations will give you a tiny error. It varies between 5 and 10%, but in some syringes can be up to 15% inaccuracy of to where this is. But there is only a very small inaccuracy on the markings. But again, with the 3-dose, we're not going to be using the markings per se, apart from for drawing up your fluid and then mixing it up. The second thing is looking at accuracy. How accurate are we, the software, at delivering the product? Well, this is an interesting study. Don't get confused with all the figures. Let's just look at the most important figures are at the bottom in the percentage wise. But this is a little study that we did using willing participants, basically at the Monaco conference. As people went by the booth, we said, come along, do you inject toxins? And we chose about 10 people to say, if they did inject toxins, we asked them to be able to use a syringe and needle and deliver a standard amount. So we asked them to deliver 0.2 mils of fluid. So basically that is just 2 tiny little gradations on a 1 mil syringe, okay? And we assessed how accurate they were at delivering that amount. And again, similarly on different people, we asked them to deliver 0.005. You know, that is half a gradation. And we assessed how accurate they were. So the red figures means they didn't deliver the right amount. It was less than required. And the green figure meant they went over. So you can see that number 100. That meant he delivered 100% more than was required. So instead of delivering 0.04 with the syringe and needle, they delivered 0.08. So almost a double dose. Just asking people to deliver a particular dose gave an error range between -30, i.e. not delivering enough toxin, to 172. That is 172, 1.75 times more toxin than they perceived that they would be able to inject. No one got absolutely 100%, exactly the right amount. Someone came to just over 2% over once. That was on just giving them one single dose. The second thing we asked them to do was say, right, well, rather than delivering 0.02, deliver the normal amount that you would deliver. So if someone was delivering 0.1, that one syringe, could you do that accurately? Or if you were delivering 0.04 or 0.05, depending on the dilution you use, just deliver the amount that you normally use in your practice. And again, you can see there was a wide variety. Some people were still underdosing, looking at using the syringe to see how much they were delivering. And some people were overdosing by about 25%. Now, this has implications for your practice, because if you're underdosing, you're not treating your patients accurately. If you're overdosing, you're probably potentially giving a little bit too much. We know toxins, you've got a bit more flexibility nowadays, but what it means is you're overdosing the patient, you're using too much, and therefore you're wasting toxin. You're not being able to treat the whole area. And you can see the people who we chose had good experience. They ranged between 5 to 13 years of injecting experience. So no matter how long you've been injecting, a needle and syringe does give you inaccuracies. And those inaccuracies, I think, are partly due to the marking inaccuracy, but also the parallax error. Most of you will remember when we were taught how to measure, you know, when you remember, go back, put your mind back to your GCSEs at school, when they said, asked you to measure something, they asked you to make sure that everything was at right angles, that your eye was at right angles to the marking, and then you got an accurate measurement. If you're at an angle to the marking, and most of us, when we're injecting a patient, will not have our heads at right angles to a syringe. We will be angling the syringe, we will be looking around, and therefore we will have a parallax error. I think all of these contribute to our inaccuracies in our injection. So that was quite an interesting study that showed how inaccurate we are as injectors. And this is something that we could try and overcome. And this is where I think the 3-dose helps us a lot. The second thing, I apologize for this error, is this picture is what I call the point of view. This is what the patient sees when I'm injecting them. And the top two is me trying to inject with a normal syringe, because I have to wear my glasses. And when I'm injecting, I can't look through my glasses and inject because of, you know, old age is catching up on me. Okay. We have to, I have to look over my glasses. So that immediately makes me look very odd. And it also means I have to concentrate hard on these markings. And the patient gets a bit worried because I look worried when I'm concentrating hard. And we know that patients pick up on our sort of aura. If we look worried, the patients also get a bit worried. The bottom picture is me looking a lot happier because I'm using a 3-dose syringe, it's clicking, and I can just concentrate on the patient, make sure that they're comfortable. I can just smile, be very relaxed, and continue injecting without even looking at the syringe, because I can get a tactile feedback and I hear the clicks as I'm delivering the right amount. So
you also look a lot much younger on the picture,
yeah, I'm less worried, less stressed, you see. So it makes you much more happier. And happy doctors have happy patients. That's the thing to remember. Steve and Diane showed that unhappy doctors have unhappy patients. So if you're a happy doctor, I would say you get happy patients. So most of my patients are happy. And as Frank said, there are 2 different types depending on the type of toxin you use, the green or the orange. I'll speak on them shortly. I've tended to go towards the orange because it's a much smaller volume delivery. You can see it's 0.04, 0.02, and 0.01, which is very useful for my microtox practice. I'm delivering 0.01 little droplets very accurately. Every single drop I put in is exactly 0.01. I know that. And as long as it doesn't squirt out of the skin, I know it gets delivered. So the accuracy is there. Each one is sterile packed and it's a single use. Right, so how do I use it? Well, I use it because there are lots of different issues with the syringe. Frank touched on a few of them. Right? He touched on the audible feedback, the tactile feedback, and this little window that is at the end of the syringe here that tells you how many doses you have left in the syringe depending on the selection that you've made. So if you were choosing 0.04 mils and you have the plunger set up on here, just by looking at the window here, it tells me I have 10 shots left. I don't have to make any calculations. I know I've got 10 shots, and is that enough to treat this patient? Okay. If I, for example, now drop that down to 0.02, of course, you know that will be 20, but it already tells me that's 20. I don't have to think. And if I go to 0.01, it tells me I've got 40 shots of 0.01, which is quite right because I've pulled my plunger back to 0.4. Okay. Obviously, this grip is quite nice. It sits very comfortably in your hand, depending on how you hold your syringe. Some people will put the syringe between the index and middle finger. Some people put it between the ring and middle finger, and you can turn the rest round to make it comfortable in your hand. And the back of the thumb piece is also slightly larger, so you can use the interphalangeal joint of your thumb to use that on the thumb piece to control. If you put the tip of your thumb, sometimes when you're delivering 0.01 mils, you can press too hard, but moving your thumb up along that piece means that you can really control that really accurately, and you can inject very, very small amounts. The little black bar is your brake. It puts the clicker on and off. So when you're drawing up your product, pull the brake back, and you can pull your product up through your needle and into the vial. When you're ready to go, just drop the brake back, and now the clicker is engaged, and away you go. And I've set that at 0.04.
Sorry, can I just interrupt? We are actually seeing your screen. We're not able to see you.
Okay, I'll be stopping that shortly, but I'll show you that when I come onto it. Okay, so
Thanks.
you will push that brake back, and then you will use it. So that's how it works in principle. And finally, that low dead space, you're not going to waste any product. I will show you the screen shortly. Don't try and learn these dilutions. Vlow have very kindly reprinted that on the back of the box. So when you buy a box, all that information pertaining to that syringe is in the back of the box. And so you can make up your dilutions if you need to, or if you're into maths, you can work it out yourself. Okay, so that's the important thing, that you can deliver things accurately and safely. So let me just stop that and then show you how I use this in my practice. Okay, right. I'm just using my orange needle here. So your brake is on the top here. You take your brake off, and then this works like a normal syringe. Okay, so you can pop a needle on, draw your dilutant up, inject it into your vial, and draw it back up. Once you've drawn it up, you can set your delivery. So for this particular case, I'm going to set the delivery at 0.04. Okay. And then the brake goes back on. And once that brake is on, now every time you hear a click, you will deliver 0.04. Okay. Now I hate to say this, but you can actually inject with your eyes closed. Please don't try that on your patients. Your patients won't like to see you with your eyes closed. But literally, I can hold that. If I close my eyes there, let's click. That's 0.04. That's 0.04. And that's 0.04. Okay. And I can use the base of my thumb. I can use the interphalangeal joint of my thumb to just rest it and do it. Now, the best thing is, let's say you suddenly think, actually, I want to halve my dose. Rather than giving 4 units or 0.04, I want to give 2 units, right? Now, all you need to do there is take your brake off, and there's a 0.02 delivery layer there. That you put that in, put your brake on, and when you look in the window, now I'm looking at the window here, it's telling me 14. That tells me I've got 14 shots of 0.02. Okay, I don't even have to look on the gradations and try and work out, how many mils is there and how many mils divided by 0.2 mils. Nothing. It's made it really easy for me. So if I need to do 14 shots, I've got enough there. Okay, if I need more, I need to now refill. But now I've got 0.2 mils drawn up, brake is on. Now every click is 0.2 mils. If you're changing measured delivery systems halfway through a treatment, be very careful. It's very easy to use the same pressure and put too much in. Okay, so just get used to what is required. You're just pressing a little bit lightly, and that's 0.02. And the one I really love, and this is the one I really love, is the 0.01. I challenge anyone to consistently deliver that one gradation that you see on a syringe very accurately over time. So when you're doing up microtox on the face or wherever, this is where it comes in really useful. 0.01 mils intradermally. There you are. You can hear that. Okay. Each click. And imagine how quickly you can go if you're just doing that all the time. Okay. So very quick. A disadvantage with this is if you're using a very narrow needle, and most of us do, I use a 33 gauge, you have to give time between you hearing the click, wait a few seconds, take your finger off the plunger, again wait a few seconds because there is a delay in the fluid because the fluid is slightly compressed because of the pressure build-up between the very narrow needle and the plunger. So you have to wait a few minutes, for a few seconds, sorry, not minutes, but seconds, to allow the fluid to have flown out. As soon as you hear the click, if you then pull the needle back, you'll see a lovely fountain of product going out. Alison, you've been there, I've been there, and you're just thinking, how many pounds is that being wasted as I'm injecting? Okay, so just give a little bit of time between injecting, take your finger off this plunger, wait a couple of seconds, and then take the needle out. And then you'll deliver it all intradermally as you do it. So that's with the orange syringe. The green syringe is best suited, I think, for people who are use Azulur on its on-label dilution. So if you're using the Azulur with 0.63 mils for 125 units, this is already ready for you to deliver 0.05 mils, that's 10 units, 0.025, that's 5 units, and 0.125, 2.5 units of Azulur, right? Which is probably your microtox type delivery systems. So those two syringes will, I think, cover most of your practice as you go through. Now, I hope that's given you a good idea. I just want to run through one little poll here. Now, if I can get this up. You can choose as many answers as you like on this, and then I'll take any questions. Yeah, so Alison, yeah, the green I think is for Azulur. I would use that unless, of course, you play around with changing your dilution. I wouldn't, it just makes it messy. We do know that you can use any dilutions. Okay, someone was in the wrong webinar, but there's always somebody there. Fabulous. I love you. Oh, really? as I said, I now almost exclusively use the orange needle. I think it's, you know, I just play around with dilutions, but I'm experimental in my injections now. But you will find once you start using it, I really can't use anything else now. I had to suffer last month because I ran out of 3-dose syringes. I forgot to order in time because I forgot there was something called Brexit, and it did hold up a few things, despite the people in power saying there will be no difference. There's been a delay, but we've now got it. But for the first couple of weeks of last month, I was using a normal syringe and I was not happy at all because I was having to look over my syringes. I was it slowed my practice down. It was awful. Wonderful. There you go. You can see a lot of people there. Those of you who would like more information, just put your details into the chat box and I'll share that with the Vlow team, and we'll make sure you can get access to it. But as Jessica said, you can get 20% off by going to their website and ordering online. Those in the UK, there is a customs charge now, which we didn't have. It's coming in. Those of you who voted for Brexit, there you are. That's your penance. yeah. Okay, wonderful. Any questions, anyone? I think we've got that. Leela, we'll get that onto you. Thank you. Well, great. Well, everyone, thank you very much for your time. I know you've all given up an hour. We've been talking here for about an hour. We'll stay. We'll leave the room open if anyone needs to go. Rajan feeding kids and being golden daddy of the day. Be more than happy. We'll carry on, and we'll have a lot more teaching. We're going to kick off our face-to-face teaching, hopefully middle of April, starting off in London. We've got a couple of courses which will be all coming through soon. It'll be the mid-face and lower face toxin and filler courses, where you will see the 3-dose in use, and you will all get a chance to use it if you come onto our courses. So thank you everyone, and Frank, Jessica, thank you very much.
Thank you.
Thank you.
Thank you,
evening, everyone. Stay safe and be well.
Same for you. Thank you. Bye.
Thank you so much. Bye.
Bye, Raja.
How many of us are left? Are we?
There's 2, 4, 5 or 6 people left. Are you all right, Alison? Did we answer everything for you?
I'm confused whether it's green or orange for Azalor.
Oh, Azalor is green.
Right. Okay.
Green, yeah. So the markings on the green one come at 0.05, which is if you're using your 0.63 dilution.
Yeah.
That's 10 units.
I'm so institutionalized. So I'm a 0.3 ml Azalor girl. I alter the dilution.
Right.
Depending on what mood I'm in. I'm terrible. So whenever I do a precision dose, so you know, if you're doing sort of the lateral lines and you just want a peak prevention is what I call it.
Yeah.
You just want to put a teeny dot in. That's where, when you're tired at the end of the day, you're more likely to
overdo it. Yeah.
Put in too much, and then you've got a toast. You know, well, not an actual ptosis, but it's more than you wanted.
Yeah.
So I either change the dilution or I use the 4T. You know, the FMS
syringe. Yeah.
Precision syringes, but I always make a big song and dance about it, saying these are my precision ones.
Yeah. But you see, this one will give you that precision, because if you did a 0.63 normal dilution, right, you set it at 0.05, and that's giving you your 10 units.
That's it. So when you're here or really close to the eye here,
then you want to go to about, well, you want to probably give two and a half units. Right? And that's very easy because you just dial down to 0.125.
Yeah, that's good.
Right, and so you can do that halfway through your treatment. You don't have to wait to the end. You know, you just think, right, I'm just going to put 0.025.
Well, if you're doing hyperhidrosis as well, and you're doing, you know, that's another case where your blebs are bigger than small and big and small and big and small.
Yeah, you get. I mean, this is great for the
absolutely
the hyperhidrosis, because you just literally not having to even look at the syringe means you're just getting that click, and all you're doing is as soon as you hear the click, you stop, move on, and it really speeds your treatment up no end.
Because I use the Restylane skin booster as well with a cannula. And I love that. That's one of my favorite treatments.
Well,
I don't do it as skin boosting.
I think that Restylane skin booster clicker was based on the on generation 1 of this. Is that right? Wasn't that right? I think, Frank, there was some discussions that took place with
I'm sure
Galderma about this. But and it's a nice. The easiest way to remember it, Alison, is remember that the green Galderma syringes. Go through the green of this. Yeah. So no,
I've got
no
buckets of those.
Yes, I've still got a lot. They were very good for that particular use.
They're very good, but they're very inaccurate. I can't use them. They're just
they come out too quickly. No, but I think if you go onto this, you'll there's no going.
Well, I think it'd be handy coming out of lockdown because we'll be so rusty. It'll be helpful. Putting your stabilizer wheels back on.
Oh gosh, yeah, I know. It is scary, actually, the number of people. I just, as plastic surgeons, there's a group of us. There's about 150 of us all in one forum that we've been talking about mentoring each other, or not mentoring, but assisting each other, going into cases together, just for the first few weeks, just so that when we start operating, we actually know which end of a knife to hold.
Yeah, exactly.
It's scary. Great. Okay, I think Frank, Jessica, I've got the got some names and everything here, which we can. I don't know if you've seen them as well. You can share them up. You can just take them on. But,
okay, perfect.
Brilliant. Okay, fabulous, Alison. We shall see you in due course. Have a lovely evening.
And you. Thank you very much. That was great.
Take care.
All.
Everyone.
Bye-bye.
Bye.
Bye.